started. Good afternoon. My name is Diane Prinzel, and I'm the Program Manager with the Delaware Readiness teams. We're excited to have you join us here today for the Family Mental Health Information Session. This meeting is being recorded, and a link to this recording will be available after our meeting. All participants are going to receive a follow-up email, including a link and the resources that are discussed today. And all participants currently right now are muted so that you can hear our panelists when they speak. So to kick us off, I just wanted to give you a little background on why we're holding this session. In June, the Delaware Readiness teams in Rodell conducted a parent survey to better understand the needs of families during the pandemic. We had over 1,000 Delaware parents share their thoughts, feedback, and experiences. And so some of the things that we learned is that parents, caregivers, and families are really dealing with a lot during the COVID-19 crisis, and there's still a lot of questions out there. We found that 84% of the parents reported that their stress level was much higher or somewhat higher than usual. We found that 72% of the families reported that they, their children, or both of them missed medical checkups or medical services of some kind during the pandemic. And we found that 87% of parents said that they had changes to their routines that were very disruptive or somewhat disruptive to their children. And families also said that they were really looking for additional supports in the areas of health and safety, mental health, and additional educational resources for their children and their families. And so today we're going to explore the topic of mental health. In August, we looked at the topic of health and safety, and a link to this session and other related resources that were discussed are available on the Delaware Readiness Team website. We're going to be hosting a family information session on October 6th at 1 o'clock, and this session is going to focus in on free educational resources that are available to young children. We want to have the opportunity to really explore those resources that are there, and the purpose of the session is these resources. So here are some additional details about this meeting, and we're looking forward to exploring the topic of mental health. As a parent myself of 2 boys, I know these are some stressful times, just trying to balance school, work, home life, and just the overall well-being as we're trying to adapt during this time. And many families like myself have so many questions that remain, and we're just, looking for some of the answers. We're going to hear from 4 panelists who will provide us with an overview of mental health during the pandemic, including how to support your child, yourself, and then resources that are available to help. As a reminder, this session is geared towards families to provide mental health information and give you an opportunity to ask questions that you might have. So after we've heard from each of the panelists, we're going to open it up for questions, and you can feel free to use the chat box to type in your questions. And you can type these questions in at any time, but we are going to wait until we've heard from each of the panelists until we start answering those questions. So let me introduce you to the panelists. Our first panelist is Megan Walls. She's a pediatric psychologist at Nemours AI DuPont Hospital for Children. Next, we have Nija, who is the program coordinator with Prevent Child Abuse Delaware. We have Sav Bennett, who is an early childhood mental health consultant with the Delaware Division of Prevention and Behavioral Services, Department of Services for Children, Youth, and Their Families. And from the same department, we also have Kier Burkle, who is an early childhood mental specialist consultant. And so we welcome our panelists, and we are very excited to get started. We also have a special guest, Tracy Quill, who we're going to hear from at the end of our program. And we're excited to get started. So we're going to go ahead and have Megan start us off. Megan?
Hey, can you guys hear me okay? Yes, I can't see you guys. There we go. Okay, so I do not have a slide panel, partially because I think part of this is important to talk about without reading sentences, especially surrounding our kiddos and COVID. When Diane and the Readiness team asked me to speak, we thought something really important was to just generally understand where we are with kids and mental health, especially during this time. And I think it's important to look at the big picture. So what do we know? And then I will talk about briefly just a few things that I think are important to think about. So first of all, what we know is this year has been really difficult and difficult for young children, and that we are seeing some increases in mental health difficulties. So that may look like changes in behavior, more depressive symptoms. We know for our older kids, we are starting to see a trend of increased concerns about things like suicidal ideation. So we know this COVID's having a really big impact on kids. And when we think about it, it makes complete sense. People are stuck home. We think about what kids need to thrive, and that's social interaction and that sense of purpose, even at a young age. And kids are really struggling to get that, as are parents. So I think, to those of you who are parents listening, thinking about your own mental health is also really, really important. When we talk about things like how kids are adjusting, what we should do, I like to think about the big picture. So when I'm talking to parents, my first thing that I want to know is what's going on. So opening the conversation with your kids, even little guys, it is amazing what our 3 and 4 and 5-year-olds hear and know. And sometimes we don't ask. So just checking in. How are you? How are you doing? And in relation to COVID, it's okay, even at that young age, to say, do you still have questions? Are there things that are confusing? We have had some really beautiful conversations with some really little guys around this. And I think it's so important that as adults, we think about the fact that kids should be able to ask us those questions, and we want them to get the answers that are helpful to them. So what do we do? So this is a super novel virus. I've been saying novel virus, novel family situation, because lots more people are home, or kids have been home. And so we want to think about, in terms of mental health, how do we work against all of those things I talked about? Isolation, losing sense of purpose, losing sense of time. I don't know about the rest of you on here, but I am a parent and don't know what day it is sometimes. Because I don't know, we're all here and there's lots of people in my house and we're trying our best. And so we have to get that back for our kids. That's the number one way we can start to get ahead of the mental health problems that might happen. So I think about things like giving ourselves grace, knowing it's not going to be perfect, but think about your schedules, think about your routines. A lot of kids are back in childcare or school now, whether that's virtual or in person. So I want parents to really think about, am I putting my kid to bed the same time I did last year? Are they eating lunch? Are they making sure that they're having a routine? So routines are incredibly important. And I also always caveat this with, I'm not talking about those like Pinterest color coordinated every hour schedules. No one can do that consistently. So don't think that that's what you need to do, and don't be hard on yourself. If your schedule is just, we make sure my kid's up an hour before school, they have somewhere to sit at that, sit during the day, or if they're in childcare, we know what time we're going to leave, and that your kid knows that schedule. So don't be too hard on yourself, but schedules are super important. For our younger kids, sleep is probably the thing I am most pushy about around how to improve functioning. Sleep helps kids regulate emotions. Sleep helps kids learn better. So making sure your child is getting to bed on time. I think we all think like, oh, we should get 8 hours of sleep, but our little guys, especially as we think about some of these early childhood kids, they need a lot more than that. So our school-aged kids should be getting at least 9 hours of sleep. Our toddlers need some toddlers, there's a range, but need up to 11 hours. So if you count backwards, we gotta put those kids to bed. And some kids are still napping, right? So that counts in their total day. But just thinking about sleep is really important. And I've noticed with my patients during COVID, this has become a mess because all of us are just doing our best. And it feels like a little bit like summer every day if your kids are starting to not have to go to school and get up and go places. So thinking about that, I think, is really important. Another thing that I think is incredibly important is, what do we do with our kids to foster comfort and safety and those types of things? And that, I think, is we give them our quality time, not just our quantity time. So as you all are sitting here as caregivers, don't worry if you have a busy day at work one day, but then take 10 minutes, turn off your phone, put it down, and spend those 10 quality minutes with your kid. Research shows us that 5 to 10 minutes of one-on-one time where a parent is not distracted improves behavior, it improves the kid's emotional functioning. So it's such a little thing, but it's a really, really big thing. I think the other things that I think about around getting us back on track are things like being creative about social solutions. So as we learn more about COVID, right, that maybe you're a family who's not really comfortable seeing people are being out about, but there's one neighborhood family you're comfortable with your kids playing outside. Or you have your kid do really fun things like write letters to their friends, which sounds silly, but my 5-year-old, now 6, I have never seen her more excited during COVID than the day she got her little letter back from another friend. So thinking about how to be creative to make sure kids have connections, but remembering that at this age, kids really, for the younger kids, they really need parents. And as the kids get older, they need more and more of that social interaction. So be creative about that. I expect kids to have a hard time right now. If your kid is having a great time, congratulations, but you are not probably in the majority of us. But it doesn't mean that your kid has a mental health disorder. It doesn't mean they have PTSD from COVID. It might just mean this is a hard adjustment. But I do like parents to keep an eye on those things, because if it gets to the point where it is bad, I know some of the folks after me are going to talk about some of the really awesome services that we have for young kids. But my sticking point is, when do we do that? When do we know, and how do we get them appropriately? So I think a lot about changes in our kids' behavior or our kids' mood. For our little guys, that might be not sleeping. That might be more tantrums. That might be acting out. So if we can all think about, how do we make sure we're recognizing those signs in our kids and make sure we get them help? And the one other thing I'll say about that, and then I'll give just 3 quick things that I think would be good to do with your kids at home that are one-liners. But the other thing I'll say about that is, I think we have this impression in our society that like going to a psychologist early doesn't make sense, and that, oh, they're 3, how could they possibly need that? But I really want to emphasize with any of you out there who are parents, the earlier you deal with these things, the easier they are to deal with. And the earlier you get rid of that stigma for your kids, the better off they are long-term. So we can say, maybe you need mental health treatment later on in life, and it's not scary anymore because you've already seen a psychologist or a behavior therapist or someone. The last little piece I'll give before I pass this off is, there are 3, and I will send these videos, which I meant to send before, along, so we're not going to go through them, but there are 3 main coping skills that I love for kids of all ages. One is diaphragmatic breathing, which is getting your kids to do slow, low belly breathing. My little guys who I do it with lay on the floor and do slow up and down breathing. For you parents listening, please do this with your kids when they do it. There is a ton of adult health research on this. So parents, no, they're not necessarily parents, adults who do this regularly actually lower their blood pressure. And they did one study, which I continue to fall back on because I just think it's so interesting, is that they had a group of adults who did diaphragmatic breathing for mild high blood pressure versus meds, and they came out with the same outcomes in the end. So I always say to families, like, I'm pro-medicine, I'm pro-intervention, but think about how much power you have to change how you feel. Progressive muscle relaxation is another one for our kids who hold their stress. We want them to let go of that stress. And that actually makes them tense and then release their muscles. It feels really good. So one of the examples is we squeeze our hands like lemons are in them as hard as we can, and then we let go. And when we do that with our kids, we're actually teaching them, you can feel the stress and then you can let it go. Little kids love this, but I have teenage patients who think this is the best activity. And then the third one is guided imagery. So especially for those kids, even little guys having trouble going to bed, you can find this free on YouTube. You can Google kids guided imagery and it will talk about them being on a beach or in a cloud or in a forest. And I just think these things are so inherently important to us helping our kids learn coping skills early and carrying them on. And so my overall takeaways here are, we know this is going to affect kids. We know COVID is, we know this sort of new learning environment is. We should keep our eyes on our kids' behaviors and their moods, but we should also know that there's a lot of things out there that can help. And we should also practice these coping skills when we can. And the very last thing I will say, and I'm so glad you mentioned this, Diane, is we have definitely seen a decrease in those kids coming in for like well visits and vaccines and those other health issues. And I will say, at least from a Nemours perspective, there is nowhere I feel safer during COVID than in my clinic. we're healthcare professionals. We follow the rules. Not everyone else does that. So please, if you're a parent out there too, kind of toying with, does my kid need to get in just for their well checks? Make sure you do that. We really are keeping kids safe, and we want to make sure we get them off on the best foot. And at the end of the day, from both a mental health and health perspective, prevention is really where that is. So thank you. I will hand it back over to you, Diane.
Thank you, Megan. Now we're going to hear from Naja.
Hello, everyone. My name is Naja Williams. I'm with Parental Resilience, Delaware, and I'm just going to talk a little bit about something called protective factors in child mental health. And I'm actually going to share my screen. I have a couple of slides. I heard what Megan said, but I need slides because I'm a chatty Cathy, and this prevents me from going too far. So I am going to show a couple of slides. So, like I said, I'm going to talk about protective factors. In child welfare and similar fields, there was a history of looking at risk factors. Risk factors are attributes that a family may have that are considered negative, being below poverty line, having children who are below their reading level, things like that. And so because they were considered negative or are considered negative, families often wanted to stay away from those things, and they sometimes wouldn't attend programs and activities because they were associated with these risk factors. That was making resources not being utilized the way they should. So what researchers and professionals did, they turned it into protective factors. Protective factors are attributes that families have that are good. They strengthen, they nurture, they help families, they help the individuals within the families. And so that's what I'm going to talk about. I'm going to go ahead and talk about what they are. So these protective factors that I'm going to talk about are from the Center for the Study of Social Policy. There are 5 of them. On each slide, you'll see the name of the protective factor, the definition, and then what it looks like, and everyday actions that a family or a person can do in order to build and help those protective factors. So the first one is parental resilience. Parental resilience is the ability to deal effectively with stress, adversity, or trauma. And basically, it's being hopeful and optimistic about what's going on. We all know that things happen in our lives that aren't always positive, but it's important for us, especially as adults, to push through. Push through, come out on the other side a better person. Making sure you're taking care of yourself, asking for help when you need it. That's what it looks like. Some of the everyday actions that an adult can do to build this protective factor is, like Megan said, finding a routine, sticking to that routine, but being able to modify the daily activities. If things happen a little different one day, that's okay. You know, being gentle with yourself. We're often the harshest critics of ourselves. So being gentle with yourself, understanding that, yes, maybe you did something you shouldn't have done or made a mistake, but, you know, learn from that mistake, do something different next time. So being resilient and bouncing back from things that may happen in our lives that we may not necessarily like. The next one is social connections. Social connections is building and having positive relationships that provide some kind of support. We all have relationships, family relationships, friends relationships, intimate relationships. Whatever those relationships are, it's important for them to be positive. That's having multiple friendships, not just having one person you go to all the time, but multiple people who you can go to, being respected and appreciated within those relationships, accepting help, but also giving help. Some of the everyday things we can do to improve these social connections is reaching out to family and friends and other people who are supporting us, checking in on people who may need help, sending texts and emails, things like that that can help to make someone's day. Like Megan said about her little one who received her letter, she was so excited. You know, those are things that we may not always think of doing, but it's important for us to make sure we do in order to maintain those social connections and positive relationships that we have. Having knowledge of parenting and child development is also a protective factor, because the more parents know about child development and know about parenting, hopefully the more they're able to change and manage the things that they're dealing with. As far as knowledge of parenting, knowing that the way you were parented isn't necessarily the way you may need to parent your children. The way you parent your 16-year-old is not necessarily the way you parent your 6-year-old. And it's okay to make those different changes based on your child's specific needs. As far as child development, knowing appropriate developmental expectations. So knowing what's expected of your 3-year-old, when you're perhaps expecting too much from your 7-year-old, and things like that can help to build the child-parent relationship, but also build and nurture the family as a whole. Some of the everyday actions, again, having a routine, identifying coping strategies that work for you, your child, and your family. You may attend a class or a training. Maybe someone will make mention of something that could be helpful to you, and you find that it doesn't work for you. It's okay. It's okay to, we all have our toolbox. Some of the tools you use, some of the tools you don't. But it's just important to find out what works for you, what works for your child, and also what works for your family. Concrete support in time of need. Protective factor means that you have access to concrete support and services that are just your family needs. What it looks like is seeking and receiving support when you need it, having knowing what services are available to you and your family and how to access those services, being persistent. Sometimes you may make a call and you don't get that call back. You may send an email, you don't get a response. Being persistent, doing it again and keep doing it until you get a response, until you get what you need, what your child needs, what your family needs. Being the best advocate for yourself and your family is very important and a wonderful way to receive your concrete support. Some of the everyday actions, again, reaching out to other people, reaching out for yourself, knowing what's offered to your family and available to your family. Sometimes with the protective factors, they kind of work with one another. For example, I have a neighbor and we were talking and she was talking about all the new roles that she has within her home as far as educating her child and taking care of her child. And I said, oh, well, at least you can take lunch lady off your list. And she says, no. I said, well, your kids, they don't go to the bus down the street. There's a bus down the street from our house that hands out lunch and breakfast. And she said, oh, I live in Brandywine School District, but my kids go to a charter school. I said, oh, no. Any child can go to that bus and get their breakfast and their lunch. They don't have to be in Brandywine School, go to a Brandywine school. It's any child under the age of 18. And she's like, oh, so she calls a friend who lives around the corner who also has children in charter schools, and now they decided they're going to make that a part of their daily routine, getting the kids away from their electronics during their break, walking to the bus, getting lunch, and coming back. So again, the social connections, the concrete support, those things work together, and it was important for her to receive that information, but then to also pass it on to other people. And finally, the last protective factor is social emotional competence of children, and that's when families and kids interact and help children to develop the ability to communicate clearly, regulate their emotions, maintain relationships. For the parent, it's warm and consistent responses to the child, making and forming a secure attachment. For the child, a lot of times it's having age-appropriate self-regulation and also having positive interactions with others. Everyday action that can help this is encouraging peer relationships, also strengthening problem-solving skills for that child. So altogether, these are the 5 protective factors. And as you, in each slide, there was a little flyer in the corner that has the name of the protective factor, but then the way it was labeled by parents. So social connections is simply making a friend. And the reason they did that is because they felt like it was easier for parents and families to remember what the protective factors were when they were using their own language. So when Diane asked me to participate in this, one of the things she asked me to talk about was why parent and caregiver mental health is so important. We all know the kids feed off of the energy of adults. If you're happy, usually your children are happy. When you're not talking very much, your children may reflect some of those same behaviors. And we want parents to be happy and nurtured and make sure that they're having social connections that are strong, because that is serving as a model for their kids. When their kids see that their family, their parents are in safe, protective, nurturing relationships, then they want those same things. So hopefully when they get older, that's what they'll provide for their families. We all know that we can't take care of other people until we're taking care of ourselves. I'm sure you've all heard the story of, if you're on a plane, you have to put on your mask first because you have to make sure that you're okay in order to take care of someone else. And that's what we want families to do. We want parents to understand that these protective factors are things that any family can build upon to create nurturing and strong families. And then finally, again, I'm from Prevent Child Abuse Delaware, and so of course that's our goal. And we know that parents who are in a good place mentally are less likely to abuse or neglect their children. And we know that parents want to take care of their children, but sometimes there are stressors and things going on in their lives that create situations where where they're not able to do the best that they can do. And so we want to help parents to understand that there are things, simple everyday things that we can all do to help children and help our families and help make sure that we're all, growing and moving through these things as best as we can. So that is my little presentation. Thank you very much. I'm done.
Thank you so much, Naja. Okay, so now we're going to turn it over to Stav and Kier, who have a presentation.
Hello, everyone. Good afternoon. Thank you for inviting us, Diane and Dr. Wall and Ms. Williams. You guys are very great presentation, a lot of useful information. You guys are tough acts to follow. So everyone that's tuned in, welcome again. My name is Kier and my colleague Stav. We are early childhood mental health consultants, and primarily we provide consultation services to the preschool environment all throughout Delaware. I think we have up to 13, don't quote me on that, of consultants in all 3 counties who work with teachers, directors in preschools, home preschools, and our job is to reduce suspension and expulsion of preschoolers throughout the different schools and to help teachers manage and reduce behaviors in the classrooms. Next slide. So what we want to talk about today is mental distress. And mental distress, our working definition, is a range of symptoms and experiences related to a person's internal life. Basically, feelings of being troubled, confused because of out of ordinary situations. And of course, 2020 is a year of out of ordinary situations. First COVID died, then we have the pandemic, then we are learning virtually, we're doing everything virtually, happy hour virtually. These situations are just totally out of the ordinary. So of course, mental distress is very unique to every individual. How I display or might experience mental distress might not be the same for the next person. But we wanted to put emphasis on a report that the CDC did about what is mental distress, and they indicated that no matter what type of symptoms you have, what type of mental distress you're experiencing, interventions are very helpful in coping with mental distress. And not necessarily mental health interventions where you're speaking to a psychotherapist or a psychologist. It could be, reaching out, building those strengths within your support group to help cope with mental distress. So mental distress, this study that we identified, it's really extensive, it's really long. Of course, we only have 10 minutes, so I can't really go over it all, but I want to encourage everyone to look at this study because it talks about mental distress during the COVID-19 pandemic among US adults without pre-existing mental health conditions. And one thing that Dr. Wall indicated is that because this is such an unusual situation, we may think that we have a mental illness or other type of underlying mental disorder, but the whole world is experiencing this out of the ordinary situation. So a lot of people are experiencing these troubled, confused feelings without pre-existing mental health conditions or diagnoses. Next slide. So let's talk about what the findings from the CDC found, or what the CDC study found. Well, number one, it found that, they used the national representation of individuals who did not have a history of mental illness. So like I said before, a lot of people in this country and throughout the world are experiencing these depressed-like symptoms. They also found that at least 15% of all participated experienced at least 2 distress symptoms for at least 3 days during the pandemic. Now, I think they canceled St. Patrick's Day, so it started around March, and they told us that it was going to be 2 weeks. And, here we are in September going into October, and we're still dealing with these out of the ordinary situations. So it's safe to assume that, we've been feeling distress symptoms for at least more than 3 days. I want to say a week, but those who experience or identify with mental distress at least 2 to 3 days. There are protective factors to help with, I guess, not having too many mental distress symptoms. And those protective factors were having a higher income and being of an older age. Now, having a higher income, that's self-explanatory, but I really don't know why being of an older age was a protective factor, but it's all in the study. So also another thing that the study found were risk factors, or what kind of increase your mental distress. And number one, it was women have a higher rate of experiencing mental distress. And usually it's no secret that the majority of caregivers are women. So not only are they dealing with their own mental distress, they're dealing with the mental distress of their children. Of course, being separated, divorced, or a single parent is a risk factor. Again, I can't imagine. I've been married to my wife for 25 years and we only have one child. And I couldn't imagine doing it by myself. However, I know that there are single parents all over the world that are doing it. So of course, that's going to be a risk factor. Searching online or trying to get information about COVID-19 is another risk factor. We live in a 24-hour news cycle. We got CNN, Fox, MSNBC, we got Facebook, we got Instagram. We're being bombarded with information, and the study found that, looking or maybe being exposed to information about COVID helps or increases distress symptoms or other symptoms dealing with mental distress. Using social media to post information about COVID-19 is also another risk factor. Of course, pay cuts or reducing income, financial difficulties is absolutely a risk factor. And also, most importantly, perceiving a sense of hopelessness. And I think Dr. Wall and Ms. Williams emphasize that, having a good attitude despite difficult times makes a, world of difference. So they indicated that people, who are feeling hopeless have risk factors. Next. So very quickly, and these are overall symptoms. You may experience these symptoms, you may not, but these are some overall symptoms of mental distress, which is weight fluctuations when you're not trying to lose weight or gain weight, irritability, being on edge, and I think we can all relate to that, having anxious thoughts, worrying a lot, thinking the worst, or depressed moods, excessive feelings of hopelessness are symptoms. Physical symptoms that can't be explained by a medical condition. I mean, listening to the news, seeing that the whole world has been affected by this pandemic, causes a lot of mental psychosomatic symptoms that people might experience. And of course, decreasing activities that one was or is interested in. And a lot of these symptoms, they look like depression, they look like anxiety, but it doesn't necessarily mean that you have general anxiety disorder or major depression disorder. It's Stav's turn.
Probably should mute myself for this part. So now that Kiara has put us in a great mood, I'm here to talk about what do you do when you acknowledge that you have these signs of mental distress? I think everybody has checked off at least, 14 of those symptoms, as they're looking at Kiara's list. We all have these, these signs. And so what do we do about them? And so I want to piggyback on what Megan and Nija said about taking care of yourself. There are the obvious self-care tips. Get exercise, eat healthy. We've all heard these things. We've talked about them a little bit in here, maintaining positive relationships and connections in your life. These are all great. But what I'm going to talk about today is talking about self-care tips for you that aren't on the typical list. These are things that you want to consider doing for yourself and your family that don't require money, much time, just require you to change how you approach the stressors that you're experiencing. So the first one is to practice patience with yourself and your child. Give yourself and your child a break right now. Remember, back in March, your child was picked up from school and never saw their friends again. That's really hard. understanding the difficulty that they might be experiencing and empathizing with that, and knowing that it's not necessarily about you. We oftentimes attribute kids' behaviors to, well, they're trying to be a jerk to me. We personalize it. But kids give us hard times for lots of reasons, and now especially. So we need to try to separate our emotions from how they're behaving. Step back and take some of those good diaphragmatic breaths that Dr. Walls was talking about. At the same time, you want to give yourself some space to make mistakes. I heard Nisha talking about this. There's no handbook on how to parent during a pandemic. You're going to make mistakes. Sometimes you're going to make big mistakes. But this is not the time to be harsh with yourself. So on that note, I oftentimes tell parents, practice self-compassion. So what self-compassion is to be kind and understanding of yourself when you're suffering. We often give those we love a lot of compassion. We'll tell a friend who comes to us after a bad day, you're doing the best you can. We all make mistakes. Nobody's perfect. I believe in you. And we really believe this for them. And it's really nice to hear when somebody tells us that. But you need to notice when you're having a hard time, and you need to pause and tell yourself the things that you would tell your loved ones, like, this is really hard right now for me. How can I take care of myself in this moment? Take time out of your schedule to routinely take those deep breaths and treat yourself as you would your very best friend. Avoid judging yourself. It's not helpful, especially now. Instead, what you want to do is give yourself room to make those mistakes. You also want to recognize what is in your control and what isn't. Oftentimes we stress over things that we don't have control over anyway, things like remote learning, what the teachers assign, how much your child is going to learn this year, or what others think of you, how others behave towards you. These things are not under your control. But your own mindset, your own behavior are. So you want to concentrate on the things that you're truly able to handle. Like you can set a daily schedule, like Nisha was saying, for your family to help maintain consistency. You can check in with your kids regularly to see how they're doing, like Dr. Walls was saying, letting them know that you're there to talk. Those are the things that you have control over. You want to make sure to know the difference and to give yourself leeway for the things that aren't in your control. And the final thing I want to talk about is lowering your expectations. So in times of stress, we tend to put ourselves under a lot of pressure to do everything right. We expect ourselves to be productive, to make no mistakes, to criticize ourselves when we fail. But what we need to do is understand that what that does is set us up for failure. What we did before the pandemic may be unrealistic now. Children aren't going to get the same amount of learning. Parents aren't going to have the same amount of bandwidth to handle things you may have handled before. Some days you're not going to get done everything on your to-do list. That's okay. You know, the stressors we're facing on top of our regular lives is unprecedented. So you want to lower the expectations that you might have for yourself to be perfect, because sometimes just simply relieving ourselves of the pressures we put on us can be the best kind of self-care. So those are my tips. Sorry, they were on the slide, but we had to click through them. There they are. And you can go to the next slide, because Kiera and I also wanted to talk about some resources available to families in Delaware. One being PCIT, Parent-Child Interactive Therapy. So this is a great research-based proven treatment for parents of children aged 2 to 7 who have disruptive behaviors at home or in the community, behaviors that you just can't seem to manage. There is a great treatment for that, and there are plenty of PCIT trained therapists in the state of Delaware. We're going to, in one of the next slides, we're going to put up the brochure, and it'll have a list of some of those therapists and agencies that do PCIT. Going on kids.delaware.gov, the DSCYF website, there are a lot of early intervention and prevention services that the state of Delaware offers, parenting classes, treatment services for kids. So go on that website if you want to take a look. Also, the Child Priority Response Hotline for crisis services. That's the number, or you can text DE to the number 741-741. Mentalhealthdelaware.com has been recently updated and has a lot of great resources for families. The Delaware DSCYF Facebook page also has some great resources there. And the next two slides that you see are going to be, that is our brochure for early childhood mental health consultation. So if you are experiencing, or if you're a parent or a caregiver and you have a child who's experiencing challenging behaviors in your daycare setting or in your child care setting, have the daycare or child care setting fill out this form and send it in, and we can go in and kind of assess and determine what kind of services they might need. And then also the next slide shows the PCIT brochure and talks a little bit about what it is and all of the agencies and therapists in Delaware that provide this service.
Everything stops at.
Thanks, Kier.
Thank you so much. And thank you to all of our panelists. We really appreciate you sharing all of this valuable information. And so at this point, we just wanted to open it up for questions. Please use the chat box to type in any questions that you might have. And we did receive some emails prior to the session with a couple questions that I'm going to ask our panelists, so I will include those as well. But feel free to use the chat box at this point and chat in any questions that you might have for our panelists. And so while we wait for any questions that come through the chat, I'm gonna start with one of the questions that we got was, what mental health supports are out there to help our non-English speaking families?
So I would like to answer that. For the early childhood mental health consultants, in all 3 counties, there are bilingual consultants that can work with child care centers or home daycare centers that are Spanish speaking. We provide the same thing as our English speaking centers, child specific consultation or either classroom wide consultation, and we remain there for as long as the provider director needs us. There are also bilingual PCIT providers. Don't quote me on the agencies, but I know that they're out there. And if you call the hotline or go on the website, I think they're there as well. So the same things that we provide for our English-speaking clientele, for lack of a better term, there are availability for the Spanish community.
Diane, I'll also add that both St. Paul's Counseling Center and Nemours have Spanish-speaking providers, and I will get over to you to share with the participants during the COVID testing. A lot of when we were doing the testing in the Spanish-speaking communities in Sussex, we actually created an entire document of all the Spanish-speaking mental health providers in the state and who's doing virtual and who's seeing kids. So I will share that out to you, Diane, if you can share it with participants. I hadn't thought to share that, but that's a great question. And I think it's really important. And also I'll say, as people are doing virtual and telehealth, it makes it even easier, because if you're in a different county, you can still see someone who's perhaps, otherwise an hour away. So I'll get that to you all too.
Wonderful. And just to remind all of our participants, I am going to be sending out an email after this, and it will have the slides from the presentations as well as follow-up resources and the recording to this. So everything will be sent out. So I did see something in the chat of, can I get some brochures, and we will send that out electronically so that you can get all of this information and have copies of that so you can share that with families as well. Again, just a reminder to put any questions in the chat box. Another question that we received through email prior to the session was, is too much screen time going to affect my child's mental health?
I'll take it. So I think there's a couple pieces to this question. I've had a lot of these conversations with parents lately. The first is, what do we know about screen time in general, mental health, right? So even before pandemic, we know there are some links to things like more difficulty with attention. For your older kids, the more they were on screens with social media, higher levels of depression and anxiety, and that was pre-COVID. So we already knew those things were standing. I think I like to pivot this question a little bit to think about more, how can we be creative to minimize our kids' screen time? I don't think any of us are going to be able to say we know the exact outcomes for years after pandemic world and virtual school and all of this. But I highly recommend for parents to talk to your kids 2, 4, 18 about what your plan is in your house, and to have some rules around screen time. We do know that sometimes kiddos who are stuck on screens all day also aren't moving, so that's a complicating factor, and the boredom and the inattention. So making sure kids are moving when they're not on those screens. And then when they're not in school, I highly suggest having an app. There's an app called Screen Time that can monitor your kids, and it is the best app ever because your kids can't fight with you because the tablet just turns off. And so it is my best parenting tool. You can't turn it back on. I can't turn it back on after that long of the day. So, I think managing screen time is really important, but I don't want to blow off the fact that we need a little bit more screen time right now, and we have to be a little bit more flexible. We're all sitting here on a Zoom call. So I think to negate that would be unfair, but I think we need to keep an eye on that, and to remember that we do know that significant screen time, especially as kids' brains are developing, isn't optimal, but we can work around it a bit.
Thank you. One of the other questions we got was around when children start asking questions about the future activities and what that looks like. Is it best to tell them we're still not sure, or give them hope that things will return back to normal? What is the best way to go about how we tell our children moving forward?
I would like to take that. I would suggest being totally honest, but age appropriate. You know your children, you know what they can handle, you know what they can understand. So, we don't want to lie, we don't want to mislead our kids, we want to be completely honest, but sometimes the truth is hard for, children depending on what age they're in. So definitely the emphasis on age appropriateness.
Thank you. And then we also got several questions around the topic of just helping try to balance trying to work and having kids that are either home virtually learning, or having younger children that are home, and really trying to balance, and if there's any suggestions on how to balance that.
I'll take this one. I think my best piece of advice for that would be to know your limits, and to understand that you, like I said before, you're not going to get everything done that you got done pre-pandemic. So understand that, that there are certain times of the day that, your kid is going to be on Zoom school for hours of the day, and you feel bad about that, and there's not much else that they can do. And sometimes at the end of the day, you're spent, and you do need a little bit of that screen time, not judging yourself for it, and not giving yourself too hard of a time, and understanding that we are all doing the best we can. And so the best piece of advice I can give is to do the best you can, and understand that, you're going to, you're not going to make all the right decisions, and your kids are going to have too much screen time some days and not enough some other days. And, right now I tell parents, just keep your kids alive. That's what we're trying to figure out. We're trying to figure out how can we all manage in a way where we're not breaking down. And so making sure that you are nice to yourself, and you understand, what your limits are and what you can handle.
Thanks. Just one final reminder that if you have any questions, to put that in the chat box now. One of the other questions that we got was, are there questions I should ask my child to better understand how they are coping with the pandemic? So are there any specific questions that parents can be asking that will help?
So I think it's I think so much of it is about how we ask and not what exactly we ask, but I always suggest to parents the very first thing to ask is what do they know before how are they coping. So, hey, what do you know about coronavirus or COVID, and letting them lead the conversation, because I think sometimes we get so caught up in what exactly are we going to ask that it's harder. But I think what do you know? What questions do you have? And are there things that you want to talk about versus what scares you or what's worried, and starting out on that. But I think with those follow-up questions.
And I'd also like to add to that, praise, 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 praise. You know, praise them for asking, praise them for talking to you, praise them for coming to you. You know, just making sure that you are acknowledging that they are communicating with you, and that that's something that you want them to continue doing. And I think Diane got kicked off.
We lost Diane.
Maybe Diane did get kicked off. I lost her power. Hi, I'm Tracy Quill and Carney, and I was supposed to give closing remarks. So maybe I'll jump in at least until Diane comes back. First of all, I want to thank all the participants and all the panelists. I feel like I've had a really good therapy session, and I hope all the participants too. What a wonderful panel. It also, and that was for me, and I don't even have kids at home anymore. Our kids are in their mid-20s, so they're long gone. But that was very helpful. Thank you. It also reinforced sort of the 3 lessons that I've taken away as someone who is not an expert, but who has just, had the luxury of spending time learning about programs for kids. And all the successful programs I've encountered have 3 things in common that I think speak to our lessons for all of us as parents. The first thing is the 2-generation approach is an absolute necessity. All the advice to take care of yourself so that you can take care of your kids. This plays out in all different kinds of ways. This is not a fashion. It's an absolute essential component of any effort to help our kids. So taking care of yourselves, 2-generation approach to mental health, to physical health, to all things is absolutely essential. And the second lesson I've picked up from successful programs is that there's always that one-to-one component. It's responding to the individual needs of that child and that family. And I think it was Carrie, I think you said, your child. And you may have 3 kids in the same house who need 3 completely different things right now. So that ability to know your limits, know yourself, and to know your children, and respond to them as individuals. That's a key part of any successful program for kids and any successful parenting strategy. And the final thing I've taken away from learning about programs to serve kids is that every effort has to be part of a collaborative, comprehensive approach. None of us can do everything alone, and no one activity, no one program is going to take care of all the needs. So really looking at things that this is a collaborative effort, and we have to address multiple needs at one time in order to support children and families during this difficult time and always. So those would be the 3 main things I've taken away from the last almost 4 years learning about programs for kids, and that were reinforced by everything this wonderful panel said today, which is always reassuring when what you think is confirmed by people who really know. That's always helpful. And so again, I just want to say thank you to the participants for your time today, to the panelists for lending your expertise. I'm supposed to turn it back over to Diane. Is she back? She is back.
I am back.
So Diane,
welcome
back to
to the
you to wrap
virtual
it
world. We are learning as best we can. But thank you, Tracy, for jumping in. I really appreciate that. And again, I did want to also thank all of our panelists and for all of our participants for joining us today on the topic of mental health. And as I mentioned before, you will be receiving a follow-up email. And all of this information will also be available on the Delaware Readiness Team website. So feel free to look at that. We have the health and safety information that's coming up too. And we're also going to have an educational resource family information session that's going to be held on Tuesday, October 6th. So we talked a lot about developmentally appropriate activities for your children and finding what works best for you. And there's a lot of fantastic resources out there in the state of Delaware. And so we really want to shine some light on some of our partners and the programs that are available. So we encourage you to join into that to see all of the resources that are available so you can find something for your family. And also at the same time, we want to make sure we continue to listen to the family voice. It is so important. So feel free to reach out to us on any additional topics or resources and things that you would like to hear for the upcoming months. So thank you so much for joining us, and we really appreciate your time. Bye.
Take care, everybody.
Thank you.